My name is Susanna McIntosh and welcome to our session today. I'm a member of the Environmental and Waste Management Group and I will be chairing the meeting. I'm really delighted to welcome Alasdair Meldrum, Director of Albion Environmental Ltd, and David Goodenough, who are both members of the Switch Forum and will deliver 20-minute presentations on the Switch Forum and how it can support IOSH, in particular, IOSH Environmental and Waste Management Group members. Now, Switch, if you have read your email, stands for Scottish Waste Industry Training and Competency, Health and Safety. It is a multi-partnership forum made up of organisations across all sectors within the resource management industry. And it was created a few years ago in partnership with Zero Waste Scotland, the waste industry members, local authorities and trade union representations, with support from the Health and Safety Executive. Switch is now a charity, and the two original members who are going to speak today will describe aims and objectives of Switch in 2020. Alasdair initially will give an introduction to Switch, as well as an update on how Switch has supported the sector through COVID-19. Alasdair Meldrum is a chartered member. He is Director of Albion Environmental Ltd and a Senior External Verifier for the SCIO. He is also a treasurer of Switch and a member of the Switch ETC group, Education, Training and Competency. The Education and Competency group creates training, learning and development opportunities for those in the waste sector. Alasdair has over 25 years of experience working in the waste and resources management sector within the UK, latterly developing, organising and delivering waste and resource management training and consultancy. He has a range of clients, including local authorities, material recycling facilities, in-vessel and AD facilities and incineration companies. Alasdair is a senior external verifier for the SCIO and has been since 2006 and ensures standards of training and assessment are maintained across centres. So I hand the first presentation over to you, Alasdair. Okay.
Thank you, Suzanne, for that introduction. Good afternoon, everybody. Hopefully you can all see the presentation in front of you. My name's Alasdair Meldrum. As Suzanne, I've got the pleasure of delivering this on behalf of Switch. As you know, the request came through from IOSH for somebody to deliver it, and I valiantly put my hand up to deliver it. Okay, so in terms of what I was going to cover, we're a bit of a double act. Myself doing the bit about Switch in general, and then David Goodenough's going to do a lesson learned from a local authority point of view of having worked through COVID. So in terms of my overview, for the ones that don't know anything about Switch, I'm going to run through a little bit about why the resource management sector needs Switch, the why about it all. How we're actually structured. We have come through a bit of a change over the last year or so, and how we're set up and how we're hoping to go forward with that. And then I'll touch on what we have been doing through COVID-19 and how we've sort of adapted to the changes. So in terms of Switch, I'm glad Susanna read out the mouthful, because I can never remember what Switch actually stands for. I quite prefer just to use the term Switch. But it was set up really as a multi-partnership forum, you know, from organisations across the whole sector, the resource management sector, to try and provide leadership and to work together to improve health and safety, training, learning, development, and technical competence, and look at you know the sector as a, you know, how do we make it an attractive career choice? Like a lot of sectors, we have got an ageing demographic in terms of a workforce. How do we change that and make these changes? So the big why. Before I go into the why, we did share a little bit of a poll just to try and, partly in my nosiness, to try and work out where people were from. And I can see from the poll there we've got, you know, a fairly big percentage that aren't involved with the waste management industry. But I would pretty much guarantee most of the people that aren't involved in the waste management industry do actually use the waste management industry, you know, whether it's for their waste or recycling service. In terms of the responsibility, I was again trying to get a feel for how many were health and safety professionals, and then also a feel for how many were involved in training and development. So we've got a good mix. So I think some of the things we'll talk about, like the competence framework, you know, we've used it for the waste sector, but it could equally apply to other sectors if there's a requirement through that. So in terms of the why for Switch, as Susanna said, Switch was developed about 5-6 years ago, and the big why was we've got a shocking reputation in terms of health and safety. We've got an accident rate that's the second worst in the UK. We're only just behind agriculture, forestry and fishing. And whatever way you look at the stats, whether it's RIDDOR stats or the HSE survey, we are fairly poor we are poor in terms of health and safety. And as well as being poor in terms of injuries and ill health, we're equally poor in terms of the number of people we manage to kill every year. Partly that's due to the type of work we do, where we're a lot of vehicle movements, a lot of plant and equipment requirements, a lot of manual handling, a lot of, you know, uneven sites and so on. But also a large part of it is we're not developing and improving the workforce as well as we maybe could. So that was really the why of Switch, if you like, way back when it was first put together. Another issue we've got is, I like to think of the sector, and I'm probably totally wrong in terms of percentages, I like to think of the sector as a third local authority, a third multinational companies, and a third SMEs. So we've got the local authorities, which generally involved in the waste collection from household level. So probably the only service in a council that goes to everybody's house once a week on the whole. You know, so that pure interaction of being out there on the streets, you know, collecting the bins has got a risk associated with it. We've then got sort of probably 8-9 major companies, your Biffas, your Veolias, your Suez, that type of company, who probably work nationally across the UK. And generally, most of them have actually got fairly comprehensive health and safety and training development systems in place. And generally, if you look at, a lot of them are members of an organisation called the Environment Services Association, and generally their safety record is better than the rest of the waste sector. But they would be the first to admit that they need to improve as well. And then we've got what is the really hard to reach sector, which is a large number of SMEs that can range from one man in a vehicle to sort of family-owned companies who are very active in sort of local communities, but they're very hard to reach for us in terms of trying to promote health and safety and training. And the last group is probably the sort of target that Switch needs to try and get into and try and influence to a greater extent. And one of I've mentioned at the top of the slide there, we've got a bit of an underreporting in terms of health and safety stats. And that's, a lot of that's down to local authorities. If they have a RIDDOR on site, they may well report it as a local authority RIDDOR rather than a waste management RIDDOR. And there has been a bit of discussion with the HSE as to, you know, whether we need to take that account or whether we need to look at that data to try and improve the data. So how does Switch try and work? We try and work by identifying emerging issues, and that's quite often members coming to us and saying, you know, we've got a particular issue with a particular thing, we've got so far with it, but we need a little bit of a hand. One example of that is obviously for staff working in picking lines and so on, the gloves they use, you want as puncture resistant a glove as possible so they don't get puncture wounds and so on. But you also need a glove that a member of staff can work on a picking line for 7.5 hours a day. So there's a real balance between, you know, you protecting them and allowing them to continue to do their job. And I know some of the members have worked hard in trying to resolve that issue with the glove manufacturers. So we're trying create creative solutions. We try and share ideas. If we come across ideas that are good, we'll try and share them. We'll try and promote best practice across the sector, and really trying to improve the standard across all the sector, whether it's by health and safety or training and development and so on. So how have we set about doing this? One of the first things we've done is try to engage with key stakeholders. And at the moment we've got the Scottish Government, SEPA, Zero Waste Scotland, Health and Safety Executive and so on as a key stakeholder within an organisation. And the likes of IOSH as well is a key stakeholder for Switch. And really what we're trying to do is either use these organisations' influence to try and help us meet what we're trying to achieve, or in some cases really just trying to help share their networks. And I know that IOSH have shared about Switch events and vice versa. We're also trying to make sure we get qualified, experienced health and safety and training specialists who are actually working, you know, at the ground level, doing the day-to-day work on site and bringing their experience into Switch. So in initial stages, it was supported by Zero Waste Scotland in terms of staff and time, largely to keep it going. So that's just a little slide of some of the partners that are in there. Most of them you'll recognise. The RMS and ESA are very much industry bodies, so if you're not involved with the waste sector, you might not be aware of them. So in terms of the changes we put forward for Switch, what effectively happened was Zero Waste Scotland was quite keen that Switch was set up by the industry for the industry. So they felt probably back end of 2018 that they were involved a little bit too much. So we went through, as an organisation, we were a group of people that tried to do, you know, the work for the sector, but we weren't really structured in any other way. So we went through a bit of soul search in 2009 to try and get ourselves set up, and eventually we got approved as a SCIO, a Scottish Charitable Incorporated Organisation. I still have the scars from my back of trying to put that together. It wasn't a particularly easy process, but eventually we got there. So really we've got 3 levels within Switch. We've got the trustees who are sort of responsible for the strategy and overall direction. You've got the ambassadors who sit in either the health and safety group or the education and training competence group. And they can either be stakeholders, so a member of IOSH, for example, as in Susanna, is a member of the education training group, and that's our conduit to IOSH. So we use that stakeholder, both as a member of the group and as a stakeholder. And then we've got Switch members who are really just people that sign up on the website, get the updates, get the invites, and we try and encourage them to share information as well. So just briefly, we've got the Switch trustees. I'm actually the treasurer. Jim Brown from BIN Group is the chair, if any of you know BIN. And then Fiona and Charlie are Zero Waste Scotland, Duncan Simpson from Duncan Simpson Associates. And I absolutely confess here, I've forgotten where Gail is now working, but she's working for an anaerobic digestion plant over in Edinburgh. We've then got the 2 working groups, the education training group, which is one myself and David both sit in, and then the health and safety working group. There is a little bit of overlap between these groups. So sometimes we sort of stray into their territory and vice versa. But what we like to try and do is keep each group, you know, engaged with what we're doing. And the chair of each of the groups is also the trustee, and that's where we get the communication there. So the people that sit in these groups, the ambassadors that sit in these groups, they are very much a working role. So although it's voluntary, it's very much, if you're signing up to sit in a group, you know, we're expecting a contribution. So we're expecting people to sit at the meeting and take on certain activities and do things between the meetings. We tend to meet quarterly and sort of driving the agenda between the meetings. So what we achieved today, to be honest, I could have had 3 or 4 slides here, but I sort of tried to pick the main ones. We have a competency framework where what we tried to do was we put together the essential skills, knowledge and experience we needed for specific roles. So a refuse collection loader, we put together all the skills necessary for that role. And then what allowed the manager or the supervisor or the member of staff to go along and rank themselves as to how they felt, just on a basic scale of 1 to 3. That then identified, you know, 3 being good, 1 being, you know, not very good, needing improvement. That then gave us a training matrix that the member of staff could then work on and develop on. We've also been involved heavily with trying to develop a SCIO passport. So within the waste sector, there's no sort of equivalent to, say, the construction CSCS card scheme for getting a basic health and safety competence into the sector. So what we've been trying to do is say, look, can we use the EU Skills SCIO passport qualification as that one day health and safety knowledge that we try and make sure everybody in the sector is trained up to that level over a period of time. That was pretty much launched at the tail end of last year, and if I'm being really, it was uptaken by a number of companies, and then I think we've been overtaken slightly with COVID. So that's going to be brought back up, you know, as we move forward. And then looking at things like, have we got the right qualifications out there? If we've got low uptake in qualification, why is that? Is it because companies aren't putting people forward, or is it because the qualifications aren't quite right there? And in theory, we've got all the necessary stakeholders together to actually help support that and develop these things. So just flicking, one of the things we're very fortunate to get at the start of the year was we managed to get funding from the Open University to develop a website. We had been relying on Zero Waste Scotland's website and various other people's websites, so we managed to get ourselves organised with a website. And all these things I've talked about and many more are on here. And the first one that's on that slide there, the WISH forum, that's the Waste Industry Safety and Health Group. That's a UK-wide group, and they've been very effective at putting together really good communication for the waste sector. Now, when we first started at Switch, a lot of people never knew anything about the WISH guidance. So we view our role as either helping develop that guidance with WISH, and then trying to promote it and making sure people are using it to the best they can. So by all means, these resources are on the website. Have a look. If you've got questions about them, just feed through in the contact page. So during the start of the year, we were just getting ourselves geared up to get back going again. And we, like many people, would get hit by COVID. And to be honest, we were not caught short, but we hadn't really got ourselves up and running. We managed very quickly to get some virtual meetings set up. And I had a member of staff that went on to furlough, but she was quite keen to continue working. So what I was able to do was get her to really work at updating the news feed. As the new guidance came in, as new things came in, we were very active in terms of putting stuff up, so that hopefully for the sector there was one place to look for information. Eventually we were doing that on news items. Eventually that was starting to get a bit confusing. So we put the big shiny COVID advice and guidance button in the front of the website to link through to a specific page. And there we tried to group it in particular, you know, areas, if you like. So the WISH guidance that was developed, I think we're now up to version 8. So WISH has been really active in developing that, and maybe some of you were involved in helping with that. But although it was great that they were updating it so regularly, it was getting really confusing as to which the current version was. So we've been active in making sure we've always got the top one up. My favourite bit on this here is probably the bit that, looking at it now, needs a little bit of a description, is the very bottom one, the templates one. And really what we're trying to do is where organisations had developed policies and practices, particularly for COVID, and David will probably give you an example. I don't want to steal his thing, but he's got some information on here where he took some information from another council, he adapted it, he used it for his organisation, and then he very kindly shared it on the Switch forum. And that meant other people could come on, pick that up, adapt it for their organisation and take it forward. So we have been, although we've been locked down, we have been active. We had to sort of re-establish our member base, because when we transitioned, we couldn't get the old database. We have organised our virtual meetings, so we're still in our quarterly meeting run. We've put together a number we put COVID pages together, and we've also done a number of webinars. We did one on bioaerosols, and we did one on dealing with COVID and so on. And we've been really active in terms of social media and stuff. So in terms of going forward, one of the real positives for us is the Scottish Government have recognised the importance of health and safety and training within the sector. I think they recognised that the organisations that were doing well through COVID were the ones that were well organised in terms of their health and safety and training and development staff. And they've also recognised it's really important to have a sort of central point for information. And they want to use Switch as that central point for health and safety for the sector. So we're hopeful, we're almost across the line in terms of Scottish Government giving us a little bit of support to help us do that. So that's a really positive that's coming out of all this. But really going forward, you know, at the moment, my resource that was on furlough is no longer on furlough, so we've sort of lost that resource. So as an organisation, we're all voluntary. We need to try and keep the momentum going. And the overall focus is, you know, what we've always set out to do: improving health and safety training and development across the sector, building some of the successes we've had in terms of the competence framework and SCIO passport and so on. And the key here is really this working collaboratively. One of the really interesting things during COVID was when the household waste recycling centre sites were closed, there was a real sort of multi-agency approach to getting them reopened. So in the past, you could go to a household waste recycling centre site and the staff, and generally they had little or no contact with management, little or no support. Whereas during COVID there was a sort of multi-agency approach where you had the police, the roads department, the waste management services, everybody sort of trying to work together as to how they were going to run these things safely. And I think at one point it went a little bit too far focusing on the COVID, when actually for this member of staff working on the site, COVID was probably the least of his worries. The highest risk he had of getting injured was slips, trips, falls, manual handling, getting hit by a vehicle and so on. So it's very definitely yes, COVID's an issue for the sector, but also we've got lots of other, you know, pretty dangerous things we're doing as well that we need to make sure we focus on. So apart from that, that's a really quick fly through in terms of what Switch is about. If you are interested, you know, by all means, have a look at what's on the website. There is if you scroll down towards the bottom of the website, there is this member form, really basic, your name, your email, your telephone number, and that just gets you on the mailing list for sending you updates. We don't plague people, we don't send vast amounts out, but hopefully keeps you in the loop for what's happening. And I think that was me. I'm quite happy taking questions.
Yeah. Oh, thank you, Alasdair. I did have a couple of questions come through. One was about your accident and ill health stats. Were they Scottish or UK stats? Were they UK stats?
These were UK stats.
Okay, great. And what do you think is the most successful initiative for engaging small businesses? I mean, was it the competency framework? I thought that was a really good supportive initiative, but is there any other initiatives you can think of that we did?
I think the most important one is the one we've not done yet.
All right.
And that's the one trying to get, you know, quite often, if you look at the supply chain and the waste management, it's often the big companies that win the contract, and then they subcontract it to the smaller companies. Yeah. And if we really want to improve the smaller companies, we need these larger companies to put a sort of health and safety standard, whether it's health and safety or a training standard in there, and try and enforce it through, or not enforce it, but try and encourage it through procurement. Okay. That's the big. I think that's the big step we've got to try and take.
Yeah, no, I agree. And what do you think IOSH waste management group members could do to benefit Switch? Because I know you talked about it's Scottish, but actually we do welcome members from all around the world. I know we had some membership from Canada. So what do you think they could do to support resources? Maybe we could get international resources as well. You know, information across the world from other people.
Well, I know, for example, the competence framework that we've done has been shared internationally. You know, and I know for a fact, you know, it's freely available. Anybody in the world can download it and use it. And I think it's just getting feedback in these things. You know, so if there's people doing, you know, the whole remit of Switch is to share good practice. If there's somebody got good practice that they think's relevant, then we're quite happy sharing it. I think that was a lot of the reason why during COVID, I was quite keen that somebody was posting information up regularly, because I felt it was actually a really good time in terms of people developing sort of really simple, clear-cut guidance and so on. That, there's a danger some of that will be lost. That, maybe we should be putting together a sort of COVID toolkit type thing, or something for the future.
Yeah, and it's not just certification in Scotland. As I said, anyone can uptake the competency framework across the world. It's something you can apply to your waste sector wherever you're staying. It's not just dedicated to Scotland. It just was created in Scotland as such. So thank you. There was another question that came in. Okay, we'll have some more questions at the end, and please provide them on the Q&A system. And if we can't get through to them at the end of the talk today, there will be a transcript downloaded, and someone can email the answers to you, the groups, if that happens to be the case. Okay, so thank you, Alasdair. That was very interesting. So our next speaker is David Goodenough. He is also a member of Switch, and as said, and he's going to talk about COVID-19 and the lessons learned from a local authority. David Goodenough works currently for West Lothian Council. He's done that for the last 8.5 years. He's also an external verifier for SQA and a member of the Switch ETC Education, Training and Competency Group. And I remember Alasdair mentioned ambassadors for Switch, and that is what David Goodenough is, and myself as well. We are ambassadors for Switch, trying to promote the organisation. So I'll hand over now to David Goodenough, and he can give his talk. Thank you.
Hello, everybody. Hopefully that's everyone can see the screen there. I just realised with Alasdair's bit, I probably need to set a bit of context given the audience here. So, myself, I work for the Fleet Recycling and Waste Services section of West Lothian Council. West Lothian is a council. It's in between Edinburgh and Glasgow. It's about 470 square kilometres in size, and we've got about 81,000 households that we service in terms of waste side of things. I've got 210 employees working for my section, and we run a transfer station, as well as having 5 recycling centres and about 150 recycling points. So that's just to give a context for where we are and where we sit. I'm just going to try and, I'm having the same problems. There we go, got it working. So effectively what we should be covering today is trying to do the COVID lessons learned from a local authority perspective, particularly in terms of the collection service, which is where we felt the biggest impacts initially. And hopefully I want to cover a bit of industry perspective about that, the timeline of COVID as it developed within Scotland, but also how it developed for us as a service, and what we did along that timeline, how we worked, what didn't work, how we coped and adapted, and all of that with health, safety and well-being at the heart of it. Kind of along a similar theme to Alasdair, the starter slide here is for folk in the waste industry, this is the old slide about the 3 planet principles, where we use resources at a rate that consumes 3 planets worth, whereas we only have 1. But in this case, it was just to highlight that fact that that's what the world looks like before, during and after COVID. And I'm not trying to be flippant, but as Alasdair said, as an industry, we need to not lose sight of the fact that there are lots of things more likely to kill or injure our employees or people going past our work activities than COVID. But what COVID is just another layer of complexity that we have to try and adapt to, whilst trying to ensure that everyone comes to work and leaves work again with all of their fingers and toes attached. The figures, the same ones that Alasdair was highlighting there, were the fact that, as an industry, part of the reason why we've got things like Switch and trying to encourage sharing of best practice is the fact that, we are 17 times higher than the all industry average in terms of fatal injuries. And also we're nearly double the average in terms of non-fatal injuries. So we can't afford to take our eye off the ball from the business as usual operations, but we do need to add these COVID controls and procedures as an additional layer, so that it doesn't reduce any of that, but also taking into account that won't reduce the level of protection the existing controls are there for in the first place. So without further ado, onto COVID. So this timeline here was the sort of Scottish timeline that the government had published in terms of where we were at. So folk should be familiar with timelines like this from wherever they are. Effectively, the first notified case in Scotland was the 1st of March. The global pandemic was declared on the 11th of the month. The schools in Scotland closed on the 20th, and then lockdown proper started on the 23rd of March with reviews every 3 weeks. So what I'm going to try and do now is talk you through the timeline of how we worked internally within the section, and particularly from the perspective of those who are continuing to deliver services as key workers. And we were key workers, even though we're in a section that's not as front and centre as the National Health Service or personal care, but we are a service that's essential for maintaining public health nonetheless. So taking it all the way back to the 17th of February, as folk might have been aware watching the news and listening, there was obviously what was going on in China, but also it started to become closer to home with the cases and the outbreaks within Italy, and we kind of felt that something wasn't particularly right. So we've always had continuity business plans for, you know, pandemics or other issues, but they always involve training up other staff from other sections, but it was never really followed through. But we managed to convince people to allow us to take their staff off other duties to actually train them up. So from that week commencing the 17th of February, we trained up 36 street cleansing operatives, 8 road operatives, 10 grounds maintenance seasonal staff who would have been coming in to do grass cutting over the summer, as well as 9 of the office staff, including the likes of myself, getting retrained over that full 4-week period. The training, we were very, very specific with this. It was the full refuse collection operative training, because the process, the depth of the training and the budgeting system with experienced crews afterwards had to be the same as our regular collection loaders. The safety of everyone undertaking the roles is dependent on the collection team all having a thorough understanding of the activities and to look out for each other. And what we didn't want was to introduce a potential weak link into that system just because we were trying to react to the COVID side of things. So that was the 17th of February, and then we rolled forward a couple of weeks, and hopefully this sort of slide comes up okay for people. But the next bit was sort of taking that big contingency plan and trying to make it more relevant. So what you can see here is a slide which showed the simplification of what was often a weighty corporate tome for many organizations, because the reality is if something kicks off as it did in this case with COVID, nobody's going to want to wade through 60 pages of words to try and figure out what service can be run, how it can be run, and by who. It's not necessarily rocket science, but we wrote similar plans for disposal, recycling centres and fleet, so that any manager or emergency officer could pick up the plan and understand what could actually be delivered on a given day. Behind that, there are things like the lists of personnel who are trained with the training records in terms of HGV licenses or able to work on collection duties. But the first thing that you need to understand is what level of service could be delivered for that given level of resource. And actually putting it as simply as this made it easy to communicate that corporately and internally politically later on. So the spin forward to the next thing, it's always football's fault was our issue here. So one of our employees on the 5th of March, before the 5th of March, on the 26th of February, had gone to watch his beloved football team play in Portugal. And to save money, he flew in via Milan. So this is coming back to that Italian outbreak. And on the way back, he didn't feel very great. And on the 5th of March, he had to isolate for 14 days. Now, this for us was something about it coming closer to home, and it was a signal of what was to come, because what it really showed was that we can't prevent happening what was happening, but what we had to do was try and figure out a way to comply and manage if this started to go. So our only option really was to try and build some resilience and try and adapt as quickly as possible to what ended up coming around the corner. So in terms of the reaction to that, the immediate thing obviously was about we deep cleaned the employee's vehicle. We requested guidance, whether it was corporately, sector-wise, but there wasn't actually at that point in time any directly relevant and useful government guidance. There was a lot of information about social distancing, avoiding public places, but there was very little at a practical level for those who would be seen as needing to continue to operate services. So from a lessons learned point of view, I'd suggest that at a government department level and sector body level, there's really a need to focus rather than just repeating on the public guidance, which was important to get across, but also developing practical sector guidance swiftly, because people will continue to be running those services. So what we ended up having to do was we issued a memo to our staff to help provide support and reassurance and guidance, and that's available on the Switch website there. We also made sure that all our vehicle hand washing stations were serviced and hygiene guidance was issued in line with the public guidance. At this point in time, there was a shortage of hand sanitizer as well, but we purchased soap because it worked just as well and you could follow the instructions to use it. And at the same time, we engaged with partners to share what we thought were our guidance and was a good idea through the likes of Switch, the trade unions, through contractors that we worked with that might have different ideas, other councils, and also LARAC. And when we had those exemplars, as Alasdair said, we put them on the Switch website. So the next thing that we had was prioritisation of services. So going back to that contingency plan, whilst we had that contingency plan in place, we needed an ability to be able to draw on that resource. So all other services within the operational services section followed a similar plan to create that contingency planning to ensure we knew what critical activities were. And once the service management had agreed that, it meant that resources could then flow freely between services, which were, originally obviously focusing on their own priorities. The priorities before lockdown were, admittedly cemeteries and burials first, followed by school meal provision, vulnerable clients being transported to day centres, and then it was the residual waste collection service. As soon as lockdown happened, number 2 and number 3 disappeared off the list, so it became cemeteries, then residual waste collection. And this then enabled us to draw on the resource that we'd trained earlier without question or argument, which made things a lot easier to manage. The next thing on the 17th of March came was staying at home guidance. So this was the start of the curve of absence. So council guidance was issued that mirrored the government guidance regarding symptoms and isolation periods. So because the absence doesn't necessarily count against monitoring either, quite rightly, because you want to encourage people not to come to work if they've got the chance of spreading it to people, it then meant the absence levels jumped by nearly 50%. And then this meant that we had to draw on the trained resources that we trained up in February under that agreed prioritisation process, which meant that we could still actually deliver all the services that we would run on a normal day of the week, just with different staff. So despite all the guidance being issued, there was clear confusion in the initial weeks, because if we remember at the start of things in terms of the UK, there was about 7-day isolation period if you had symptoms, and a number of staff were off because of symptoms at the time of year. There's lots of coughs, colds and flus anyway. Then around a week or so later, the guidance changed to say that anyone was off for a 14-day period if someone in the household had symptoms, and this triggered more people to be off because you were now, potentially increasing by 4-fold the number of people that could cause an employee to need to be off. And at this time, there was still no testing available. So this was all done on a basis of trust and common sense. But it did see 50% of the staff being off. And this was the guidance document that we issued to the staff so that they could understand the situation and quite clearly see how they would need to follow isolation protocols depending on their household makeup. So the next thing that happened was lockdown itself, the 23rd of March. Mothering Sunday for this country had happened on the Sunday before. It was a very strange day with people wondering whether they should be in or should be out. And what happened there was a home working memo got issued to all staff courtesy of Rhodes to ensure that people's contact numbers were correct and emails were correct, because at this point, the non-essential back office staff were all leaving the offices to go and work from home. So the guidance covered self-isolation advice, what you do if you use your own car, how to use council equipment remotely, and it made our depot very, very empty. I mean, our depot normally can hold up to 1,000 frontline staff and probably 300 office staff. And we probably went down to just having the 100 waste collection staff that were operating in a day, 16 to 18 mechanics, a couple of facilities management staff who were looking after the school meal transportation side of things, and a few admin people, and that was it. So it was very, very empty. And it also meant that we were setting up a lot of WhatsApp groups between colleagues and other methods of making sure that we still communicated internally and externally. And it turned out that everyone was in the same boat. So the next thing practically was the day after lockdown started, we were trying to come up with ways to be able to maintain the service, but ensure that we were protecting our staff following the guidance at the time. So what we did is we went to a driver +1 in the refuse collection vehicle cab and the use of a pool car for the third loader. So this is the bit that Alasdair referred to in terms of Mid-Lothian Council had come up with some very good advice, which was following along these lines, and we just adapted that to suit ourselves and then put that document onto the Switch website for other people to be able to follow if they wanted or to adapt. So what we ended up doing was having discussions with our trade union reps, the colleagues from other councils and our staff to try and find something that would make them feel comfortable with what we were doing and that did fit the guidance. So being the fleet manager as well, it was relatively easy to get 29 pool cars when most other office staff had all gone working from home. So that gave us the way of doing it. And the clear communication that was issued was that this isn't the main way of limiting transmission, because the steps are still the ones that were listed there below about making sure you don't come to work if you've got symptoms or you live with someone, that you keep the hand hygiene up, that you minimize gathering. And we're trying to reinforce that, this is an additional control in amongst the primary ones. So this is what our collection service ended up looking like, and it sort of still does to a certain extent today, where we've got the driver and one loader in the vehicle. Now they wear face masks when they're in with more than one person, and the second loader is following in a pool car. So that was one of those things. But one of the interesting issues that did arise was the fact that a lot of staff didn't have driving licenses. Something for people to consider in future planning. We had enough to be able to staff the pool cars and have the non-driving people in as the other loader in the refuse collection vehicle. But it's clear that the days of turning 17 years old and getting a driving license as quickly as possible are gone. And people don't necessarily see it as an essential thing anymore. So maybe we should look at providing car license lessons and training as well as HGV lessons going forward. Oops, sorry, we've gone and excitedly gone to the end for some reason. Here we go. Oops. So internally in the depot itself, one of the other things that we did was it was about making things look different, and then people will start to act different. It couldn't be the same as it always had been. So we changed the way that we did the dispatch process and the debrief process for staff at the end of the shift. So we had individual chairs that you can see around a room that was spaced out. You ended up with the bags and the keys were placed on the chair and left there so that they could be disinfected. The debriefs were done at a distance, only by one crew member rather than having all three crew members coming in. So it was all that bit about trying to minimize the direct contact at this point in time, but also just making people feel more comfortable that there were options not to have to congregate with other staff members. So the next part we got to was something that affected quite a lot of other Scottish local authorities, and there was some coordination done with COSLA to try and survey every week every Scottish authority to give the government a picture of what services were and were not operating. So from a West Lothian point of view, like many others, our recycling centres were closed because they were not deemed essential journeys. From the 24th of March, most were shut on the 23rd or 24th. Our bulky waste collection service, where we physically go to your house to pick up things like fridges, freezers, sofas, that was suspended, but we continued for the existing bookings to honour them because they'd been paid. But the key thing, going back to that contingency plan, was that the buy-in from senior management and elected members was there to make sure that we maintained curbside collections, because the feeling was, from a public point of view, from a cleansing point of view, from a recycling point of view, that it was very important to have some kind of normality in a world that definitely wasn't normal. So that's where we were given the resource to make sure we could continue to deliver the service on schedule. The other thing we did is we used the guidance drafted from PHE and DEFRA about waste for waste materials for shielding households and households who might be isolating, because there was an issue at the time where there wasn't actually any direct sector-specific guidance in Scotland on that. And we also used Twitter and Facebook a lot to encourage the public to park sensibly, for example, because there were now hundreds of cars where there aren't normally because people weren't at work. And also asking the public not to approach the bin crews, because we had a lot of issues with people emptying a bin and then coming down with more bags saying, can you just take this as well? It's because I'm in the house. So we were trying to encourage people to stay distant as well. So the main bit that we had following that was about taking the team with us. Is we had to formalise all these working practice changes. So there were a lot of meetings and discussions with the trade union representatives and human resources to agree temporary changes to working agreements as well as the formal ones. So one of the things we did is that the crews normally worked Monday to Friday and every second Saturday, but what we agreed was to move the Saturday hours, which were 4 hours, to during the week, because it enabled these essential workers to have a proper weekend break. So rather than working 6 days, 1 day off, and then 5 days and 2 days off, they always had the 5 days on, 2 days off for the weekend. We also staggered the end of the shift, and we used telephones to debrief staff with the crews on the way in, because the loader could phone in whilst the driver was driving back to give us all the information that we'd had to do face-to-face before. And this is about the 2nd of April. So at the same time, we had things about shielding letters, because people had been shielding at this point in time. And it meant that some staff were returning to the depot from other services. And the bit that I've got in there about best intentions, not shirkers, is that there was quite a bit of animosity building up with services that say weren't at work because they were key workers. So grounds make garden maintenance, they weren't at work. Roads, apart from essential maintenance, weren't at work. Whereas the refuse collection loaders have been all the way through. So there was quite a lot about the hearts and minds that needed to be managed sensitively, just to, explain, oh, this is the rules, this is where we're going. They would be keen to help. We've got street sweepers helping us, and making sure that we've got all those contact methods to keep in touch with people who were still needing to genuinely shield. So then we get to the bit that was the intermission. So thankfully, due to all that planning, the team did work, because unfortunately your presenter here ended up with this being my view of the world for 10 days, because I may or may not have contracted the COVID side of things myself, and I wouldn't have wished it on anybody. But thankfully, the service were brilliant, and all the background work and planning meant that my enforced 2-week break didn't make any difference to the way that the service was run. And it just goes to show that you never know when someone might catch this thing, how badly it'll affect them, or for how long. There were other people in other sections that were a lot worse than I would have been, who were off for a lot longer, but it just shows where you need that planning in place to make it work. So I think, as I said, it's all about prior planning and teamwork. Our sickness levels plateaued. We started to allow leave opportunities. We had a continued presence from the frontline managers, and our head of service came back from being in the corporate section. We continued dialogue with trade unions, but there was this continued frustration about a lack of guidance that was coming out. So it's one of those things where one of the key things was that you absolutely need to make sure that we're working together collectively, whether it be through Switch or the likes of IOSH, to get that guidance out to people. So now we're in a position where, like I say, it's work life, but it's not as we know it. You know, sickness levels have plateaued and they've started to come down. We've been able to leave opportunities for rest and recuperation for people. Again, we've changed the way the building operates, and we've also been able to help people with everything that's going on. So one of the examples is the depot here. We obviously had one-way systems put in place within the depot so that people can move around the place safely. We provided simple signage showing walking routes, maintaining distances, that we used the approach using road signage because people were quite familiar with that. And we also separated out desks so that there was a seating plan. There are actually barriers, higher barriers between the desks opposite each other, but that wasn't actually a necessary thing at the end of the day because there were so few people in the office. I mean, you know, talking maybe 20 or 30 people in a space that previously held 300 desks. So social distancing was easy within the building. And on the back of that, we created an induction plan for any contractors or other staff or people from home working who might be coming in, so that at least they could be familiar and understand the system and setup that those of us that have been working with that the entire time would understand. And then at last, we had some national coordination regarding recycling centres, and Alice has already covered many of these points about the fact that it was the government, COSLA, SEPA, roads, police, and we got to a point where we managed to open up the recycling centres on the 1st of June, and we had 39% increase in visitors and 15,000 visits across our 5 sites. And what I've got here, sorry, is an example of what we ended up doing is basically, rather than having, I made my mouse move, rather than having all individual skips and then along the top we had all sorts of little bells and banks for glass and things, we literally split things into only having one skip for bulky waste and one skip for bag waste per car, and it being traffic controlled at the start of the site. So it meant that people could always maintain distance, they were in their own designated bays, and it meant that things ran very smoothly. So back to collection side of things, we tried to maintain efficiency while being COVID secure. Once the recycling centres are open, cross-sector groups started to look at things about collection side of the service. Social work were due to go back, so we've looked at different mitigating measures in the vehicles. So the main thing with that is face coverings were now required with more than one in a cab, where more than 2 are permitted in the cab, but for no more than 5 minutes to help things be more efficient. But all other protocols and mitigating measures stay in place. And again, this is reviewed on a regular basis, and we were doing this morning already, if there's any prevalence of the virus or changes to instructions. So in summary, just to quickly finish up, because I know my time's running out, the saga does continue. We could put together another 30 slides on test and protect from the last week alone. You know, the service ourselves, we continue to adapt to changing patterns, localized outbreaks, you know, whether people go to the pub at Glasgow at the weekend and bring back some cases which might have happened recently. And also the constantly shifting sands outside of our workplace and outside of the sector. So it's always very important that we continue to engage with the employees and the trade union reps and other groups to sort of sound out potential adaptations and to give them the best chance of succeeding, because if we don't bring the workforce along with us, putting in a measure might not actually physically work on the ground. So it's very important to bring them along. But on the plus side, you know, from what our guys have said all along, is collecting bins and running a service required for maintaining public health is at least some form of normality. You know, we go to work, we pick up bins, that bit seems relatively normal in the chaotic world that we're in. So I will draw it to close there and just say, thank you for your time and attention, everyone. And I know Susanna's going to come back and there's a chance for any questions and bits and pieces.
Yes, thank you, David. That was so interesting, and everyone's been asking whether they can have a copy of the presentation, so we will send that out to people. I did have a couple of questions about some of the occupational health standards at ISO 45001 that people have thought is a good sort of standard for the waste industry, and whether Switch would support that. I don't know what your opinion is on that at all, considering you had to prepare for COVID and just react without really much guidance and just formulate your ideas and good planning.
No,
What do you think?
well, no, at least I think things like the ISO guidance and again, even going below levels like that, the likes of the WISH guidance and updating things like that, it's very important that people have got something to go to reference and then adapt their individual situations. Because I think part of the problem we had in the initial phases was that the guidance was very airy, very strategic level about maintaining services, and you know, it didn't focus on the fact that you've got 3 guys who are wearing gloves, who are wading through waste, picking up bins that someone else has touched before, you know, an hour before when they put it out. And it was that bit that, you know, the guys on the ground needed to know to make them feel comfortable in a world where they were told, don't touch anything, don't go to work, don't go near people. So anything's helpful.
Yes, I totally appreciated that. And also, how many of your staff actually got COVID-19 in the end? I know you said you had it, but
well, I think the trouble is at the time when the absence levels went through the roof, there was no testing for any key workers really at that point in time. And you know, in recent days, you know, in terms of positive cases, we've just had the one. But there is the chance that people had things in between. So like even like myself and some of the admin team that probably had something, there's no antibody testing on the back of that. But what we were off with chimed in with all sets of symptoms. And as a 39-year-old, it was quite a good example for the guys, because as a 39-year-old who's not particularly unfit, it was horrific. And that really did sort of help people to have a frame of reference when you came back into work and they wondered where you'd been for 2 weeks, which, you know, made some people sit up and think.
yeah, so and adopted the procedures, and I love the way you laid them out for everyone to see. It looks really well planned, and I've got very good positive comments from the panel and
Thanks.
from other people regarding what you did and business continuity planning. So thank you very much. We've got a couple of minutes yet, but what I wanted to do was just tell people about the fee. Well, basically we've got a couple of sessions coming up in terms of webinars in the next couple of weeks. So do you have anything you want to say on top of the presentation, David? Because I thought it was really well presented and really liked your plans, and I think it will be very useful for other IOSH waste management group members around the world. And you're still in it at the moment, so maybe we should get you back to carry it on, you know.
Yeah, we're very much in round 2 at the moment. I think there was an interesting one that someone put in. I just flicked up the questions there about, it says, what controls were looked at for supporting individuals with mental ill health, and what would you say worked best? And I think that was one of the key things with the way that we were working with individuals and working with people at work itself, because there were varying degrees of levels of anxiety, fear about what could happen, you know, people's home situations. They might have had people who were shielding or were not necessarily getting shielding letters, but they were concerned. So we tried to be as flexible as possible with people. So, you know, there was an individual, for example, who didn't have a shielding letter, but he was looking after a very ill relative who he had to visit on a regular basis because they didn't have home care. So we were very flexible to ensure that he was either, if he was at work, he's working on his own, and they wouldn't have shared a cab with anybody. And it was all very, you know, your own lorry, you're your own person. But most of it's been about communicating with people and keeping them up to speed and trying to reassure them, which part of the thing with the waste industry, as we said at the start, is the fact that it's not the safest place to work in the first place. So everything's about trying to make it easier for you to survive a day and come back again.
Mm-hmm. Thank you. I mean, there was another question about COVID infected waste not getting into our domestic waste streams. How robust was that, and especially from those that were self-isolating? What's your opinion on that? I mean, I think your procedures sounded really good in terms of protecting the staff. So,
Yeah, the issue we had with the public side of things was, again, there's no red cross on someone's door saying that they have this particular plague. So the bit was as if people phoned in to advise, we made sure we gave that PHE guidance and eventually the Public Health Scotland guidance to the call centre. So if someone phoned in and said, what do I do? This is what happened. We also had protocols with care homes that we serviced, so that if they had anything that was COVID suspected infected waste, they put it to the side and it was logged that it was 72 hours before we'd go and pick it up. But the main protection, of course, is the same as it would be for leptospirosis or anything, is the fact that you wear your gloves, you keep the stuff away from you, your good hand hygiene. You know, that should have protected the staff as another level as well.
Okay, thank you. Well, we're nearly running to the end now. I just wanted to, so thank you very much, both David and Alasdair, for giving your presentations today, and people can access them. Any other questions, they'll, that we'll keep a copy of the transcript and we'll try and get them to answer them for you. The other thing I wanted to say, that the next webinar is going to be on the 7th of October on construction waste, with Professor Billy Hare from Caledonian University. So he'll be talking about that. Pretty much that's it for today. I would like to thank you again, and hopefully we'll see you in 2 weeks' time for the next webinar. Please thank everyone. And David Thomas will probably be back in 2 weeks doing the chairing. So thank you to everyone, and thank you.